Thank you, Mr. President. I thank the ranking leadership on this bill, but also on health care over the decades. And he knows something about the right way of doing it and the wrong way of doing it, which is partly what brings me to the floor today. I want to say something that I think will be uncontroversial to the people at home, but maybe news to some people here. And that is whether you support the Affordable Care Act or whether you don't support the Affordable Care Act, whether you've been a supporter of Obamacare or whether you're not a supporter of what is called Obamacare. In general, people are pretty dissatisfied with our health care system at home. In general, people are pretty dissatisfied with the rate their insurance goes up. They're pretty dissatisfied with the fact that a lot of people are still uncovered in this country. If they're a senior, they're pretty dissatisfied with the idea, not just the idea, with the practice that month after month after month, people have to cut their medicines in half just to get through the month. They're pretty dissatisfied with the fact that when they call an insurance company to make a claim, to say, my child was sick, to point out that month after month after month, they've paid their premiums in, only to find that on the day they make that claim, there is somebody at that insurance company who has more time than they do to stay on the phone, to keep them on that phone, to deny them their claim. They're pretty dissatisfied about that. As a whole, I think the American people are dissatisfied by the fact that we spend 16% of our gross domestic product, our entire economy, on health care, when every other industrialized country in the world spends half that, or less than half that, on health care. And this is going to come as news to some people in this chamber, and get better results, because we're moving in the wrong direction on too many dimensions when it comes to our health care. I say all that as a proponent of the Affordable Care Act. I spent a year and a half in Colorado in certain places, being called a Bolshevik or a socialist, being accused of advocating for a government takeover of our healthcare system. This was a time when the Tea Party was very active, and people would come and they'd say, quite rightly, read the bill. Read the bill. We need to take our government back. And we tried to do some things to help in that bill. We tried to say for the first time in the country's history that it wasn't okay to discriminate against people who were sick, had what is called a pre-existing condition when they went to buy health insurance. It wasn't okay, as the senator from Oregon said, it wasn't okay that if you did get sick when you had insurance and you got something like cancer, that an insurance company could just throw you off their rolls because you hit their cap. We said we thought it wasn't okay that there were millions of people, many of them children, who didn't have access to primary care. That is, a doctor to be able to give you a checkup and see how you're doing so that you weren't getting treated in the emergency room. The most expensive, the least intentional way of running a healthcare system that's imaginable. In fact, I'd say that's the Bolshevik way of running a healthcare system, is when you're sick, you get to show up at the emergency room and somebody's going to take care of you. And it gives you the results of a Bolshevik system because you're paying more for less of an outcome. So we tried to address some of those things, and that became the Affordable Care Act, that became Obamacare, that became something that was politicized for 7 years as the House of Representatives cynically, month after month voted to repeal the Affordable Care Act. And then they went home to their districts, the majority in the House, they went home to their districts and said, we repealed Obamacare. We voted to repeal Obamacare. Well, you didn't repeal it. No, we voted to repeal it. And you send me back there next week and I'll do the same thing, and I'll do it the week after that. And then at some point people started to say, well, you keep having the votes on repealing Obamacare. Why haven't you actually done it? And they said, well, we didn't have the Senate. Well, they've had the Senate now for 2 Congresses. They said, well, we didn't have the presidency. Well, now we have the same party in the presidency the Senate and the House of Representatives. And this terrible bill that we are considering, which is not a bill that anybody, it's an exaggeration, virtually anybody in my state supports or has asked for, is what we've got in front of us. Now, I know somebody else who knew that the American people were dissatisfied with their health care system, and that was Donald J. Trump when he was running for president of the United States. And I hope in particular the people that voted for the president as a way of keeping Washington accountable will remember that what he said was that he was going to provide to the American people a, quote, terrific plan to, quote, cover everyone at a fraction of the cost. You know, the president, when he was running, he still does it, was very fond of talking about, his words, how stupid everybody in Washington was. And he knew how to make deals, and he was going to come here and make great deals, and he was going to cover everybody, at a fraction of the price with a terrific plan. That's what he promised the American people. That's what he was peddling when he was running for president. He said, quote, "You're going to be taken care of much better than you're taken care of now." That's what he said. This isn't fake news. This isn't CNN or the New York Times or the Wall Street Journal or whoever is in the crosshairs today. This is what the president said on the campaign trail when he was running, because he detected, quite rightly, that the American people are unhappy with the way our healthcare system works. Unhappy in the richest country of the world to have a healthcare system where people have to make decisions about their lives and about their children's lives that no one else in the industrialized world has to make about their lives or their children's lives. And they wonder why. And I think the diagnosis has a lot to do with what some people have said, which is special interests having a grasp on Washington, D.C. But that's what the president said he was going to give to the American people. This is what his promise was to the American people. What did we get instead? We have a bill passed by the House. There was a massive tax cut for the richest people in America, which literally nobody in my town halls, in red or blue parts of my state, has ever said is something that would help with their health care. Not a single person. Not a person has said what they want for health care is a massive tax cut for people making more than $250,000 a year. Not one person. There's a 25% cut to Medicaid in this bill. That's done in the name of, I guess, reforming entitlements, and also the argument's been made, Mr. President, that there are a lot of lazy people that are on Medicaid, and if you cut Medicaid by 25%, they'll go to work, and they should go to work. Well, two issues with that. And the first is that it's important to understand who's on Medicaid. In my state, 50% of the people are children. So, Mr. President, are they supposed to be at work, or can they go to school? Then there are a whole bunch of people on Medicaid. In fact, it's a very large share of the population of Medicaid who have spent their entire life savings down for the privilege of being in a nursing home paid for by Medicaid. Are they supposed to work? And then, Mr. President, there are a lot of people, I'm ashamed to say this, there are a lot of people in this country who are working one job, two jobs, and can't make enough money to buy private insurance in the United States of America. That is a shame. Do they need to get a third or fourth job before we're saying they're not lazy? Or should we fix this healthcare system so that it's more affordable, more predictable, more transparent for American families? Those were the promises the president made. That's the content of the bill, with one addition. Slipped in between that tax cut and that 25% cut to Medicaid, which is paying for that tax cut for the wealthiest Americans, is what my colleague Rand Paul, a Republican from Kentucky, has described accurately as Obamacare light. And he's absolutely right about that. And if you hate Obamacare, you will hate Obamacare Light. Because if you're living in a rural part of my state or the country and you already can't afford insurance because there's not a market there, and you can't get a subsidy that will help you because you're making too much money, you're going to hate that even more when and wait until they pass the Cruz Amendment, which he's calling the Freedom Amendment. Freedom to have to endure something no one else in the industrialized world has to put up with, which is buying lousy insurance that doesn't cover anything. You can create the worst product in the world and make it affordable. That's not hard to do. We've come a long way from Franklin Roosevelt's 4 freedoms if we're talking about the freedom of insurance companies to be able to throw you off if you've hit the lifetime cap, the freedom not to give you insurance if you've got a pre-existing condition. We've come a long, long way. And finally, my colleagues are here, so I'm going to stop. But I do want to say one word about the process. The majority leader today announced that he's going to keep the Senate in for 2 weeks in August because they have to finish their work on health care. Or maybe it's 3 weeks in August. I don't care, Mr. President, if it's a month. I don't care if they cancel every recess that we have between now and the end of the year. I don't care if we work on weekends. If it'll create a situation where we can actually improve health care for the American people, I'm glad to stay. In fact, I think we should stay. But unfortunately, that's not what he's trying to do. What he's trying to do is jam through a bill that's incredibly unpopular with the American people. That's why until 2 weeks ago it was a secret. Until 2 Thursdays ago it was a secret. And I have to suspect that one reason they want to keep us in August is because they don't want to go home. Because they were just beaten to death over the July 4th recess. Because people came out in Republican and Democratic parts of their states and said, "Are you out of your minds? This bill has nothing to do with our health care." They probably don't want to repeat that in August. So I'll close just by saying this. And I say this again to the people who came to my town halls and were highly critical of the Affordable Care Act and the process. I want to remind you, folks, that back then, and the Senator from Oregon will remember, back then, we spent over a year debating that bill here in the Congress. We had countless, somebody could count them up, but pretty much countless committee hearings in the Health, Education, Labor Committee, the Finance Committee. We had almost 200 amendments that were Republican amendments that were adopted as part of that bill. Everybody remembers no Republican voted for it, but there were 200 Republican amendments adopted as part of that bill. We have not had a single committee hearing in the Senate about this health care bill. Not one. So you can keep us in for 2 weeks or 3 weeks longer in August, but a better idea might be to follow the regular order around this place. Talk about take our country back, take our government back, make it work, have hearings, have witnesses. I can think of 100 Coloradans off the top of my head who'd like to come here and testify. And I would even say 50 of them can be Republicans and 50 of them can be Democrats. Have them come testify on what would make health care better for them, because that's what this should be about. Families all across this country that are struggling because of our health care system and who need relief from this Congress and who so far aren't getting it. I'll close just by saying if the president could submit a proposal that actually would meet the criteria that he set out when he was running for president, instead of having a bill that he couldn't pass with even 51 Republican votes, he'd have a bill he could pass with 100 votes here in the Senate. And that's what we should strive to do. And with that, Mr. President, I yield the floor.